Welcome to this video on penile implant surgery. My name is Dr. Ryan Flanagan. I'm a urologist and trained male reproductive and sexual medicine expert. So penile implants are devices placed on the inside of the penis to create a rigid erection. So who are ideal candidates for penile implants? Men with severe erectile dysfunction who have failed more conservative medical or device therapies would be a good candidate. Men that have severe Peyronie's disease, or men with a combination of erectile dysfunction and severe Peyronie's disease could also be excellent candidates for a penile implant. There are multiple different types of implants that exist. There's inflatable implants, and this is subcategorized as 3-piece implants, which we'll talk more about in a moment, and 2-piece implants, as well as malleable implants. And these are typically used in individuals with limited dexterity, and we'll talk more about this in a moment. So a 3-piece penile implant is composed of 2 cylinders that go in the shaft of the penis. There's a pump that is buried within the scrotum that you would access to activate the device. And then there's a fluid reservoir that we typically tuck on the inside of your body, usually next to your bladder or sometimes just under the muscle. So how do we use it? When you want to get an erection after you've had a penile implant placed, you'll squeeze the pump multiple times. That's positioned within the scrotum, and this is going to move fluid from the reservoir into the cylinders. So what are some of the pros and the cons of a 3-piece penile implant? So some of the pros are that it's concealed all on the inside. It can expand both in length and girth, and the overall satisfaction rates somewhere around 90% or a little bit better. Some of the downsides are that placement of the reservoir for the fluid sometimes adds some additional risks to the procedure, especially depending on what your baseline risk factors are for this. Now, the 2-piece penile implant is similar to the 3-piece, except it doesn't have a fluid reservoir. So here, there's 2 cylinders that go on the inside of the penile shaft, and then there's a pump that's placed within the scrotum. The mechanism here is that the fluid's transferred from the back end of the device into the front, which is extending into the visible part of the penis. Some of the upsides is that, again, it's concealable all on the inside, and we don't have to place a fluid reservoir, so we mitigate some of those risks associated with fluid reservoir placement. The overall patient satisfaction rates, about 85% or a little bit better. The downside to the 2-piece implant is that it's not quite as natural feeling as the 3-piece because there's always a little bit of fluid within the penile portion of the shaft, as there's less ability to transfer fluid from the back to the front compared to when you have a fluid reservoir. The malleable penile implant does not have any additional components. So there's basically 2 cylinders that go on the inside of the penis, and there's no pump and there's no fluid reservoir. So typically you'll have this pointing down. When you want to be sexually active, you will point the penis up, and the material on the inside has a memory and rigidity to allow you to do that. So one of the pros to this is that it's all concealed on the inside, and it can work really well, especially if you have limited dexterity or ability to use your hands and fingers to activate a pump. If this is the case, then certainly the malleable implant could be a good option for you. Some of the downside to it is it's slightly less natural feeling compared to either of the inflatable implants. This is because the size is stable and it doesn't change. There's no dynamic component to it, and it's always rigid. It's just either pointed down or you point it up when you want to use it. So during a penile implant procedure, what's involved? It's a surgical procedure, typically lasts somewhere around 1 hour in duration. Now, there's 3 different approaches for placing an inflatable penile implant. There's a penile scrotal, so the incision is at the base of the penis going into the scrotum. There's an infrapubic approach where the incision is above the penis, or there's something called a subcoronal approach where we make incision circumferentially or all the way around the end of the penis on the penile shaft skin. So basically at the exact same spot as if you're to have a circumcision. Some of the key considerations here when you're going to have a penile implant is that it's an irreversible procedure. So when we place the cylinders on the inside of the penis, we're placing that where the muscle is that naturally produces the erection. So this, in a sense, destroys the muscle on the inside of the penis. And if we take the implant out, this will no longer function to the extent that it did before. So that's a really important consideration for you to know about ahead of time. Another important thing is that the penile implant in most scenarios will not add penile length. The best way to estimate what this is going to look like on the other side of the surgery is to grab the head of the penis, pull it away from your body firmly, and this is roughly the size of the penis after we place the penile implant in it. Another consideration is that when you activate the device, the penile shaft becomes rigid, but the head of the penis remains soft because this is a slightly different and anatomical part of the organ, and this part is not affected by the actual implant. So if we look at outcomes, the satisfaction rates are somewhere between 92 to 97% with the patient and between 91 and 96% for the partner of the patient, which is quite good. If we look at the long-term follow-up, so how do these devices last over time and how are people satisfied with the devices over 5, 10, 20 years? Well, we find that in 5 years, about 95% of implants are still functional and being used. Once we go to 10 years, drops down to 90%. At 15 years, 75% of implants are being used and are functional. And 20 years following the procedure, about 63% of the implants are still functional and being used. Now, if we look over the course of 20 years, on average, about half of men experience some form of a complication or a problem. Most of the time, these are mechanical failures, something breaking in the device or a malfunction, which often requires replacing the device or one of the components. 12% experience some pain or discomfort. Less than 5% experience difficulties with orgasm, and less than 5% experience a problem with infection. Now, another important thing to talk about with any surgical procedure is potential risks. Now, by and large, these procedures are very well tolerated. People do extremely well. They're either discharged home the same day or they're kept in hospital for one night. However, there are some notable potential risks that are worth talking about. Device infection is probably at the top of most implanters' minds. On average, this happens between 1 and 4%, depending on your experience. And this can certainly go up if you either have diabetes, especially if it's poorly controlled diabetes, or if this is a revision surgery, then the risks are typically a little bit higher. The significance of an infection is that you could potentially get sick, and we have to take the entire device out in most circumstances. Now, if we do this, we could potentially place another device either at that time in rare circumstances, or sometimes with a delay of 3 to 6 months. But the second time for the operation is most likely going to be quite challenging compared to the first surgery. Other less common risks include injuring the P channel or the urethra, making a hole in the actual erectile bodies. In some cases, we can continue to proceed with this, and sometimes we'll have to abort the operation and come back another day. Erosion towards the end of the penis over time from use and pressure from the inside with the device happens somewhere between 1 and 6% reported in the literature. And then some of the more serious things, making a hole in the bladder, bowel, or some of the vessels have been reported but don't have a percentage associated with it. Some of the more common things after the procedure include collection of blood or a hematoma within the scrotum or some swelling. This happens somewhere between less than 1% to less than 4% of the time. And typically this will resolve on its own. Rarely we would have to go back in and surgically correct this. The head of the penis can be floppy or more dynamic in a small percentage of men. Some will have some pain or discomfort or potentially loss of blood supply to the end of the penis in very rare circumstances. And bleeding requiring transfusion is also quite rare. So in summary, penile implants are an excellent option for men with severe Peyronie's disease, severe erectile dysfunction, or a combination of these two things. It's important to work with a well-trained and experienced surgeon in placing these implants. And it's also important to ensure that your expectations are in alignment with your surgeons and you've had an opportunity to ask all the relevant questions for this procedure and you feel comfortable moving forward. Thanks for watching this video. If you'd like more information, feel free to visit my website or the YouTube channel listed here and my Twitter handle below. Thanks very much.